The Philips Bilichek non-invasive bilirubin analyzer is a non-invasive transcutaneous bilirubinometer, which is intended as an index to predict serum bilirubin levels pre-phototherapy, during, and post-phototherapy in neonates. The information provided by the Bilichek is evaluated by the neonate's physician for appropriate patient management. In this video, we provide an overview of bilirubin assessment and demonstrate operation of the Philips Bilichek non-invasive bilirubin analyzer. Prior to using the Bilichek, you should consult the instructions for use for more detailed information about any of the procedures demonstrated in this program. Should you have any further questions, please contact your Philips sales or service representative. Hyperbilirubinemia is an unnatural yellow coloration of an infant's skin and eyes caused by an excessive buildup of bilirubin production, decreased excretion of bilirubin, or both. Hyperbilirubinemia affects approximately 60% of full-term infants and 80% of premature infants. Jaundice appears in a head-to-toe direction. The skin begins to turn yellow when the serum bilirubin reaches 5 to 7 milligrams per deciliter, or 85 to 120 micromoles per liter. The Bilichek provides a numerical measurement of predicted bilirubin count in milligrams per deciliter or micromoles per liter, within a clinically beneficial range that correlates with total serum bilirubin concentration measured by high-pressure liquid chromatography. It is intended for use in the hospital or institutional environment, including clinics, physicians' offices, and home nursing agencies, to assist clinicians in monitoring the status of neonates for the development of hyperbilirubinemia. The Bilichek analyzer assists clinicians in assessing an infant's risk for hyperbilirubinemia, reducing the number of heel sticks, and determining a newborn's risk level for hyperbilirubinemia at discharge, which can expedite the discharge process. The Bilichek can serve as a valuable tool to help assess bilirubin levels and may also be used as a universal screening tool where every healthy newborn is assessed for risk one or more times during a hospital stay. Utilizing the Bilichek aligns with the core measures for neuroprotective family-centered developmental care outlined in the Philips Neonatal Integrative Developmental Care Model. The Bilichek provides the unique advantage in that it can be used to measure bilirubin levels in neonates between 27 and 42 weeks gestation, and postnatally up to 20 days of age in neonates weighing between 950 to 4,995 grams, or 2.1 to 11.1 pounds, of any race or skin tone. The Bilichek should not be used in patients who have undergone an exchange transfusion or on measurement sites that have bruising, birthmarks, hematomas, or excessive hairiness. The Bilichek works by directing white light into the skin of the newborn and measuring the intensity of the specific wavelengths that are reflected back from the major skin components: dermal maturity, melanin, hemoglobin, and bilirubin. The intensity of the reflected light is converted to absorbance units, called optical density, for analysis. Clinical trials demonstrated the Bilichek to be highly accurate and to correlate with a high degree of confidence to high-end, research-based blood analyzers at 0.9 coefficient value with an accuracy of plus or minus 1.5 milligrams per deciliter. Its ease of use allows the Bilichek to transition from hospital to home use, enabling continuous parent-infant bonding and allowing for a speedy, early discharge. The Bilichek uses a reference standard, the BiliCal, during each clinical measurement, reducing device performance variations over time. A calibration measurement using a new BiliCal calibration tip is required before each patient measurement to facilitate the Bilichek's accuracy. Using disposable tips decreases the risk of infection from cross-contamination associated with multiple patient devices and supports your facility's hospital-acquired infection initiatives. The automatic calibration system in the Bilichek adjusts for fluctuations over time and for environmental conditions, eliminating the need for periodic factory recalibration. The Bilichek system includes the following components: Bilichek handheld unit, protective sleeve, battery door cover, power supply, battery, protective tip, charger base, instructions for use, and quick start guide. Before using the Bilichek, we need to set it up. First, connect the power cord into the power inlet here on the charger base. Plug the AC cord into a wall outlet, ensuring that all connections are secure. Place the Bilichek onto the charger base. A lightning bolt icon appears on the battery icon to indicate the battery is charging. The Bilichek battery should be fully charged prior to initial use. When fully charged, this icon appears. Now let's take a closer look at the handheld unit. It consists of the display window and the keypad. On the back is the calibration tip, the barcode scanner, the battery compartment, and the charging pins. To turn on the Bilichek, press the Enter key. This wakes it from sleep mode. It powers up and then displays the home screen. Operation of the Bilichek involves the use of the keypad to navigate through the on-screen menus. Use the up and down arrow keys to scroll through the menu options and settings. Use the left and right arrow keys to perform the actions specified on the screen. Use the Enter key to save the setting. Press the Help key at any time to display instructions for that action. Press the Home key to return to the home screen at any time. If you return to the home screen in the middle of a reading, you must restart the measurement process. From the home screen, select TCB Reading. Enter a nurse ID and two of the following forms of patient ID: patient name, patient medical record number, or patient date of birth. Enter the information using either the on-screen keyboard or use the barcode scanner. In this case, we'll use the barcode scanner. Highlight Scan In to activate the barcode scanner. Point the scanner towards the barcode and press the Enter key. The scanned information appears on the screen. Confirm the information is correct and press the Enter key. If you prefer to type the information, use the arrow keys to move to the appropriate position on the keyboard and press the Enter key to select each letter or number. When finished, highlight Done and press the Enter key to save the settings. Now we need to attach a new BiliCal tip to the handheld unit. Press it onto the unit until you hear a click, which confirms proper seating. Select Done to begin calibration. When finished, the unit beeps and displays this message. Choose an appropriate measurement site. Use either the flat area of the forehead between the infant's eyebrows or on the sternum, where a sufficient amount of blood is circulated. Avoid areas of the skin with visible bruising. The same site should be used for all readings during a measurement, and the same site should be used for all subsequent measurements. To take a measurement, pull on the BiliCal tab and peel away the protective covering and calibration material from the tip and dispose of it. Leave only the clear film on the BiliCal tip. Press the Enter key to select Done. Gently press the BiliCal tip to the selected measurement area. While maintaining skin contact with the BiliCal tip, lift the handheld unit slightly from the patient's forehead or sternum and then repeat the process 4 more times. A measurement requires a series of 5 successful readings from the same site. The measurement number on the display changes from yellow to green when proper pressure is applied. The number will return to yellow if excessive pressure is applied. A single tone sounds after each reading to indicate that it was successful. When the readings are complete, the Bilichek displays and saves all entered information. Remove and dispose of the Bilical tip and apply the protective blue plug. Then return the handheld unit to the charger base. If your device is configured to transmit data to a lab information system or electronic medical record system when the handheld unit is returned to the charger base, all records since the last data transmission will be sent. Sent status for each screen appears here on the display. This icon indicates the record has been sent. This icon indicates the record has not been sent. This icon indicates the record contains an error and cannot be sent. Select History to access patient data that is stored in the handheld unit. The unit stores up to 30 records. Once the record limit is reached, the oldest record is deleted. Select Standby from the home screen to turn the screen off between readings. During phototherapy exposure, changes occur to the skin. 2 controlled clinical studies demonstrated that when a small portion of the newborn skin is protected from the therapeutic effects of phototherapy lights, the relationship between the skin bilirubin is likely to be maintained. During phototherapy, protecting the measurement site from phototherapy light using Biliclip's phototherapy protective patch or adhesive skin patch is an important requirement. Before placing the Biliclips on the infant, always clean the skin site with a hospital-approved cleanser. Place the Biliclips patch over the measurement site prior to the start of phototherapy. Any liquids, lotions, or creams will reduce the adhesiveness of the patch and increase the likelihood that it will fall off during phototherapy. Use any necessary precautions to ensure that the patch does not move and expose the site to phototherapy lights. When it's time to take the next Bilichek measurement, make sure all phototherapy lights are turned off. Verify that the selected measurement site is still covered. As you lift the lid of the Biliclips protective patch, place your finger on the edge of the base to ensure that the entire patch is not pulled off the infant's skin. Perform the Bilichek measurement at the preferred site. Close the Biliclips lid, confirming that it achieves good contact with the base around the entire patch. Although it is unlikely that light will penetrate the sides, any light that does reach the skin could affect future Bilichek measurements. Continue or discontinue phototherapy as indicated by the latest measurement. Leave Biliclips on the skin until no further Bilichek measurements are needed. This ensures that future measurements are made from the same protected location. Remove the Biliclips once it is determined that no further phototherapy is indicated. This completes the training on how to use the Philips Bilichek non-invasive bilirubin analyzer. For complete information regarding the proper use of the device specifications, and cleaning, maintenance, and service information, refer to the Bilichek instructions for use.